Hey everybody, this is Dr. Stott from Smile Now Dentures and Implants. Join me for a patient review. So today we're going to talk about a patient that came into us. His mother had actually seen us on TV and she knew what her son was going through, and so she really felt like this could be a great solution for him. When she initially introduced him to us, she just basically said, I want my son's smile back. When we brought him in and started talking to him, we immediately noticed that he had a lot going on. We talked to him, he had done everything right. I mean, he had been going to the dentist, he had been taking care of his teeth. You'll see here that he had gotten root canals, he had gotten crowns, he had gotten fillings. He was doing what he could to try to keep his teeth in good condition, but they had broken down so much that it was time to find a solution. And what he wanted was just to be able to smile again. One thing about this patient is he works in people's homes. So he does a construction type of job where he's in people's homes, he's working on it, he has to interact with people, he runs his own company. He felt like when he would smile, people would judge him, that he wouldn't get work because of it. And all he wanted to do was live a normal life, not feel the judgment of everyone around him as they looked at his teeth and basically projected onto him all sorts of thoughts because of what his teeth looked like. It wasn't helping him as far as like his day-to-day activities. You know, he was kind of sad and depressed about, you know, do I have to deal with this for the rest of my life? So this was his situation when he came in. Now you can see here, just at a glance, the first thing I would notice is that his eyes kind of tell that story too. They're just a little bit hesitant as we're asking him to smile. He knows what his teeth look like and he's been living with them and in pain for a really long time. And so it's just not a fun situation to be reliving this moment. When we asked him to give us a bigger smile too, you can see that having a natural smile doesn't come normal to him anymore. In fact, he's more used to trying to hide his smile to protect himself and protect himself from the judgments of other people. When we do have him smile, you can see that there's a lot more going on here than, you know, what we saw just at a glance. For example, you can see here when we kind of reflected his cheeks back that he's missing a lot of his posterior teeth. And this makes a lot of sense. When you start having damage in your front teeth, a lot of the times it is because you have lost your back teeth. Once you lose your back teeth, the ones that are made and designed to chew food, then all of a sudden your front teeth are having to do that for you, and they're not really designed to do that. They're much smaller, they're more used for tearing, and because you're using them for a purpose that is, you know, you're no longer able to do, or you're using them for a purpose that they're not designed to do, what happens is they'll break down a lot quicker, they'll get more cavities. And you can see here the darkness of his teeth. That's what cavities look like. You can see kind of the white stuff around his teeth, and this specifically is plaque, and plaque is what has all the bacteria in it that can chew through the teeth over time. So when we looked at his teeth also, here you can see a lot that have broken down in the back, kind of like what I alluded to before. You can see that he had root canals before, has cavities in every single tooth, and you can even see some areas that are bleeding just from the discomfort and the pain that he deals with and the infections that he deals with on a day-to-day basis. So the good news is that we definitely have the ability to help him out with this. What I mean by that is you can see our plan. Our plan included being able to place implants, and in this situation he had enough bone so that we could remove his teeth, smooth down the bone, get out the infections, and then place the implants in the perfect position so that we could replace all of his teeth and he could have the ability to do the things that he could no longer do as is. So you can see that plan as is. In fact, if we jump forward and we look at what happened after surgery, you can see here we are able to place 6 implants up top, 6 implants down below. Now this surgery can be done with 4 surgeries. Originally, when people started doing this surgery about 25 years ago, they called it the All-On-4 surgery, and that's because 4 implants is sufficient to do it. However, at Smile Now Dentures and Implants, whenever possible, we like to add a 5th and a 6th implant using specialty implants too that go into harder portions of your bone, because that will last longer for you and that will make it a better situation for you long term to keep these teeth and keep these implants healthy. You can see here the 6 implants and then the teeth. The reason they look so white on the x-ray is because they're made out of zirconia. So zirconia is a really great material for teeth. It's something that's used in dentistry, very reliable in all sorts of areas within dentistry. Like people will do crowns with them, people will actually place implants that are made out of them. It's a material that tissues love, it's a material that bone loves. That's why it appears white on the x-rays. So this is a pretty amazing shot of him and a demonstration of what can happen. First of all, the things that I noticed is that these teeth, they look natural. They're designed for him specifically. They kind of match his personality. If you also look at the eyes, you'll see in his eyes that he's a lot more confident and happy to be taking this picture. It's not like the one that we saw at the very beginning of this video where he just knew what they looked like and he kind of knew the judgments that were going on along with it. This is one where he's excited and he's happy, and these teeth match him. They look masculine. The color is perfect for him. It just really matches. If we look here, we have a couple more pictures kind of the tissues. So you can see that this is the way that the teeth come into the tissues. You do see a tiny little silver spot on this. What that is not the implant. It's not exposed, and this isn't dangerous. That is actually the abutment, and the abutment is made to pass through the tissue and be on the outside. They're easy to clean, and in this situation, it's something that's easy to clean just like brushing his teeth would be. You can see the upper two are designed in such a way that it comes in contact with his natural tissue. There's no gaps, there's no poor fits. This is something that comes up against his tissues in such a way that when he speaks, nobody can hear him whistle or slur words or get caught up on things that just are not normal. This feels super normal to him. This feels better than what he had when he came in, for sure. You know, going back to the smile that we have afterwards, if you look from a side profile, like the teeth aren't sticking out differently. They're nice and up and down. They're vertical. His jaw comes together in the right position, in the right way. He feels super normal. So this is a wonderful case where we were able to get somebody in that was having such a hard time with their teeth. Do 6 implants up top, do 6 implants down below. It was a comfortable surgery for him. He was sleeping the entire time. We had a CRNA come in and take care of him, which is the standard of care at Smile Now Dentures and Implants. Really, this was 2 to 3 months later that he had his final teeth. He was able to move on with his life, and we look forward to maintaining this care for him for the rest of his life, taking care of him, doing the aftercare of cleaning and taking x-rays and just verifying that this smile is going to last for him for a really long time into the future. So thank you for joining me for this case review. I hope it was beneficial. If you have any questions about it or any specific comments that you want to make, leave them down in the comments and I will get to those and do a follow-up if you would like. We'll see you later.